Hello and welcome to our 10-minute series, Pathways to Digital Health. I'm Peggy Richter, and today we are diving into a topic that is crucial for improving healthcare provision, patient pathways. In this session, we'll explore what patient pathways are and why they matter, especially for healthcare professionals. So we will learn how they can drive efficiency, collaboration, guideline implementation, quality, and patient-centered care. I'd say that sounds like a promising topic, doesn't it? So follow me and let's dive in. You may be wondering, what exactly is a patient pathway? So let's start with answering this question. Essentially, patient pathways are a structured, evidence-based approach that maps out the best possible course of care for patients with specific diagnoses or conditions. Patient pathways are different from guidelines. They are comprehensive, step-by-step plans that span a patient's entire journey through the healthcare system, from diagnosis to recovery and, if necessary, palliative care. They are designed to be used by multidisciplinary teams, including doctors, nurses, therapists, and more. There's a definition from the European Joint Action IPAC, which highlights several key aspects of patient pathways in cancer care. First, patient pathways detail the phases of care, guiding the entire journey a patient takes by defining specific goals, tasks, decisions, responsibilities, and milestones. Second, they support mutual decision-making between the patient and their multidisciplinary team in a network of care providers, fostering collaboration. Lastly, patient pathways are designed to enhance the overall experience and outcomes for patients by ensuring that care is coordinated and seamless. By outlining each step of the care process, patient pathways help ensure that patients receive timely interventions and appropriate care. Now, why should healthcare professionals pay attention to patient pathways? I prepared several compelling reasons for you. We'll touch base on the benefits regarding efficiency and standardization, interdisciplinary collaboration, guideline implementation and patient safety, as well as quality management, and, last but not least, patient-centered care and patient empowerment. Let's get started. Let's first dive into the aspect of care efficiency and standardization. Patient pathways bring efficiency, transparency, and standardization to the care process, which is absolutely critical. Standardization is vital in healthcare because it ensures that patients receive consistent, high-quality care regardless of the hospital or clinic they visit. By following a well-defined patient pathway, healthcare professionals can deliver care that aligns with recent evidence and best practices every time. Standardization also means that healthcare professionals aren't constantly reinventing the wheel when treating patients with the same diagnosis. A pathway provides a clear roadmap, which saves time and resources. It allows doctors and nurses to focus on the unique needs of each patient rather than being bogged down by administrative decisions or protocol ambiguities. Everyone involved in a patient's care provision knows exactly what's expected at each step. This eliminates guesswork, reduces delays, and ensures that the patient moves efficiently through the healthcare system. Now, it's important that this does not mean that patient pathways are rigid or inflexible. They're actually quite adaptable. While they establish a framework for care, they allow healthcare providers to adjust based on individual patient needs, preferences, or even unexpected complications. If a patient has comorbidities that require special attention, the pathway can be adapted accordingly. It's all about documenting the reasoning, though. So, as a healthcare professional, patient pathways give you the support you need to make sure your patients are on the right track and to make sure that the care process is well coordinated with other involved care providers, while still giving you the flexibility to tailor care to each unique case. Let's move on to another major benefit of patient pathways, which is that they promote interdisciplinary collaboration. Healthcare today often involves multiple specialties working together, especially for complex conditions like cancer care. A good patient pathway ensures that everyone involved in a patient's care knows their role and when to step in. With clear steps and timing, the entire team stays coordinated. For managers, this clear division of tasks helps ensure that teams work together efficiently, reducing miscommunication and delays. For healthcare teams, It clarifies each professional's role, making collaboration easier and more streamlined. But of course, it is essential that the teams ideally design the patient pathway in the beginning together, agree on them, and know and live their role. Another compelling reason to use patient pathways is that they help implement evidence-based guideline recommendations into everyday clinical care. They should be developed based on the recent evidence and under consideration of clinical practice guidelines. For example, the German guideline on pancreatic cancer is complemented by a patient pathway. They use the guideline recommendations to build a patient pathway template for pancreatic cancer patients in comprehensive cancer care networks. The recommendations are directly referenced within the pathway steps, and this helps care networks to build their own pathways using this guideline-based blueprint. By embedding evidence-based guidelines into the care process, you can be confident that the care being delivered across the organization or the care network meets the highest standards. By following evidence-based steps, healthcare providers minimize the risk of errors and ensure that treatments are administered safely and effectively. This is especially crucial in complex cases where a single mistake could lead to significant complications. Now, let's continue and talk about quality management. It is central to healthcare, and patient pathways can play a major role in this. Quality management in healthcare means consistently delivering care that meets certain quality standards and results in the best possible outcomes for patients. At its core, quality management is about safety, effectiveness, patient-centeredness, and of course, efficiency. This is where patient pathways shine. They are structured to promote high-quality care by reducing variation in how treatment is provided. For healthcare professionals, this focus on quality management means we're not just treating patients in the moment. We are also thinking long-term, using pathways to ensure that our care meets the highest standards over time and across many patients. In fact, patient pathways should be designed already with quality indicators in mind, making it possible to measure and evaluate quality aspects over time. European patient pathway templates developed during the Joint Actions IPAC and CRANE, for example, already integrate quality indicators. They visualize and describe the key quality spots in cancer care and highlight their relevance for all involved care providers. And that's not just good for patient care, it's good for the healthcare system as a whole. When we can ensure consistent quality, we can cut down on unnecessary treatments, reduce readmission rates, and optimize the use of our resources. Finally, let's talk about how patient pathways foster patient-centered care and patient engagement. Patient-centered care is about putting the patient's needs, values, and preferences at the heart of the care process. Patient pathways help make this possible by clearly outlining what patients can expect at each stage of their journey. They also describe activities patients could perform themselves, like discussing options with their families, getting in contact with a patient support group, or preparing their home for the time after surgery. Patient pathways can also include information on lifestyle adjustments, such as nutrition and exercise, which allows patients to take actionable steps towards their own recovery and well-being. This transparency empowers patients to take an active role in their own healthcare, which is shown to contribute to better outcomes. So, why not striving for empowering patients to become informed quality managers of their own healthcare journey? When patient pathways are provided not only for professionals but also for patients themselves, they can see a roadmap for their care and anticipate what's next. I imagine a digital application like a patient portal to guide and inform patients along their care journey here. This helps them feel more in control and less anxious. Moreover, because pathways emphasize evidence-based practices, patients can feel confident that they are receiving the best possible care. Healthcare professionals benefit from this patient-centered focus as well. By following pathways that incorporate patient feedback and emphasize shared decision-making, we foster a stronger and more collaborative relationship with our patients. In turn, this leads to higher patient satisfaction, better adherence to treatment plans, and ultimately, better outcomes of care. Of course, implementing patient pathways isn't always easy. One of the biggest challenges is getting staff on board. Change can be difficult, and healthcare professionals might resist adopting new standardized approaches, especially if they've been practicing in certain ways for years. The key to overcoming this is leadership and clear communication. It's important to show the team how pathways will be valuable to both patients and professionals by reducing confusion, improving collaboration, and making the entire care process more efficient. Another challenge is to make sure that teams have the tools they need to follow and work with the pathways. Digital tools like electronic health records can make it easier to integrate pathways into daily practice, helping staff track where a patient is in the process and what's coming next. For managers, these tools make it simpler to monitor pathway adherence and identify areas where improvements can be made. That brings us to the end of today's episode on the importance of patient pathways for healthcare professionals. We've explored how patient pathways can improve care quality, enhance collaboration, and boost efficiency across hospitals and care networks. Looking ahead, patient pathways are going to play an even bigger role as healthcare continues to evolve. With the rise of integrated, patient-centered care and digital health applications, pathways will help coordinate care across multiple providers and settings, ensuring that no matter where a patient is, their treatment remains consistent. To sum it up, patient pathways are invaluable tools that help healthcare professionals provide seamless, evidence-based, and high-quality care. Thank you for listening in. I hope this episode has given you a clearer picture of how patient pathways are reshaping healthcare for the better. Whether you are a professional healthcare provider, a patient, or just someone curious about healthcare innovation, I hope you've come away with new insights. Until next time, stay informed, stay healthy, and keep learning. Bye-bye.